problem pets and a controversial but increasingly popular method for getting them to behave. Psychiatric drugs meant for humans. Last year, pet owners spent a combined $7 billion on drugs like Prozac and Zoloft for their pets. Now, that number is up 35% in the last 4 years. But is that money worth it? And is it even ethically correct? Here's ABC's Chris Bury.
This otherwise lovable mutt, Frisbee, is cursed with an obvious and serious affliction. 10 or 12 times a day, something, no one knows exactly what, sets Frisbee off, turning this family pet into a Tasmanian devil. So desperate for a fix, Aaron Riley hauled Frisbee to a psychiatric clinic for pets, the Animal Behavioral Center at Tufts University, where they treat animals for mental conditions usually only diagnosed in humans.
This used to be the state's mental hospital. It did.
Its founder, Dr. Nicholas Dodman, is fully aware of the irony. He is a pioneer in treating the mental health of animals, from circling shepherds to shadow-chasing terriers to dachshunds that spin like Frisbee. He is the veterinary version of a psychiatrist.
And then right into the room.
On the day we visited, a parade of troubled pets came through Dodman's office.
Thanks for coming in today. A little bit anxious.
Yeah, a little bit. Yeah, this is 200 milligrams of Zoloft right now, every day.
A German shepherd named Summer, suffering from anxiety.
I hate seeing her like that.
Prescription, a combination of 3 psychiatric meds. A Springer Spaniel, Dakota.
The problem I hear in a one-liner is owner-directed aggression.
It turns into a completely different dog.
He got a new leash, a low-protein diet, and some Prozac.
It would be better to have this Prozac in the background because it decreases aggression.
And a cat, Doogie, that relieves itself all over the house. Dodman recommended a change in the cat's litter box.
I only use medicines if I think they'll help. And some people say, yeah, but I really wanted medicine. And I say, you don't, your animal, your cat doesn't need it.
As for Frisbee,
hello, buddy.
He's seen Dr. Dodman twice.
Sometimes even when you remove the stress, it keeps going, and that's when you've got a compulsive disorder. It would be nice to have, keep the great dog and lose the Tasmanian devil aspect.
Dodman's already prescribed Prozac and an antidepressant without success and remains puzzled by Frisbee's condition.
I'm afraid to say that he is this enigma.
After this session, Frisbee gets a new prescription, naltrexone, which has been used to treat floating limb syndrome, where animals attack their own body.
Every other day for the Prozac and just and double the other one.
Half of one and then a quarter of the other one. And we just stick it in peanut butter.
Such meds are becoming more common for American pets.
Are you convinced that psychiatric medications that work on humans do work on pets?
There's absolutely no doubt that psychiatric medicines that work on people also work on pets. I mean, we've shown it over and over again.
Now those meds are flying off pharmacy shelves, from Anapril for better brain function to the generic form of Zoloft to fight anxiety.
Unfortunately, everybody's looking for the quick fix.
Trainer Cesar Milan, better known as the dog whisperer, is skeptical of mind-bending medicines for pets.
Often it's the human who is obsessive and the dog is just imitating the behavior.
The dog whisperer claims, in most cases, exercise, diet, and tough love, showing who's boss, can cure psychological problems in pets.
Rules, boundaries, limitations, understanding what their position in the family is or what is expected of them.
We showed him video of Frisbee in one of his episodes.
First, I will put him on a treadmill when he's having this kind of attacks.
A treadmill, a backpack, or even swimming might redirect his energy, the dog whisperer tells us. But for 2 years, the Chinnett's Riley family, who took in Frisbee at 7 months, have tried everything. Training, discipline, long walks to wear him out. But haven't found anything to keep Frisbee from turning into a whirling dervish. And even the dog whisperer believes in such extreme cases, medicine can be a last resort.
With dogs that have neurological problems, unfortunately, those I can't help. Those definitely will benefit with medication.
Should we be giving our pets Prozac and Xanax and these other drugs?
I think, the the goal of a veterinarian is, and hopefully a pet owner too, is to do the best thing for the animal. I mean, whatever will help it to feel better and actually, truthfully, spare its life.
As for Frisbee,
Good boy.
his owners report some improvement but no cure, so they're open to trying other meds. Meanwhile, they've decided to accept Frisbee for what he is.
Hey, Frisbee, come here.
I'm Chris Bury for Nightline in North Grafton, Massachusetts.